Good afternoon, and thank you, Governor, for your support and leadership on this important topic. Children and Family Services provide support and services to many Nebraskans in need. We focus on providing children the opportunity to succeed as adults, help the elderly and disabled live with dignity and respect, and help families care for themselves. At this time, the COVID-19 public health crisis has caused a significant disruption in the lives of Nebraskans and for all Nebraskan families, including those families served by CFS through child care subsidies. As of this morning, 481 or 16% of our licensed child care programs in Nebraska have temporarily closed since the COVID-19 emergency declaration. This means that 26%, or 4,421 out of 17,213 children whose families receive child care subsidy from the state do not have access to safe, high-quality child care for their children while they either look for work or continue to work to provide for their families. The problem is not unique to Nebraska. The nation as a whole is grappling with the loss and closure of child care programs in every state. For instance, the National Association for the Education of Young Children recently reported their internal data shows that as a nation, child care programs lost 70% of their daily attendance in 1 week. Families need care to work. And in order to serve Nebraska's workforce, the Department of Health and Human Services is continually working on innovative and proactive policies that help serve families and strengthen our local communities. This is why Governor Ricketts has announced 2 initiatives that will help families currently receiving child care subsidies, as well as help child care providers. First, starting today, families currently receiving child care subsidy who may be experiencing a child care closure will have the option of using a license-exempt in-home child care provider. This is an individual who will go to the home of the child to provide the care. Our current regulations require families receiving in-home subsidies to meet one of 3 criteria. The criteria are unusual work hours, more than 3 children receiving care, or a child who has special needs receiving care. These criteria are temporarily being waived by this executive order. Importantly, as in current practice, the person providing in-home care still must be 19 years of age, pass all applicable background and criminal background checks, and complete the department's health and safety orientation training. This option to child care subsidy families provides at least 2 benefits. First, this provides an alternate child care option for a family who may have lost their child care due to their provider or program closing. And providing this option also provides new employment opportunities for interested individuals who may have lost their employment from the COVID-19 pandemic. This could be a temporary unemployed relative, neighbor, or friend. Second, we recognize the important and critical function child care programs have in sustaining a stable workforce for Nebraska now, but also for when this pandemic ends. That is why, starting today, the division will allow licensed child care subsidy providers to bill for times when subsidy children are absent from care during this emergency declaration. Current regulations in Nebraska do not allow providers to bill the department for these absences caused by the pandemic. Many families are keeping their children home, are temporarily not working, they are working from home, or simply keeping their child home to be safe and reduce exposure and limit and flatten the curve. This has had a negative impact on our child care providers and programs who, by no fault of their own, have seen a significant reduction in their income due to this crisis. This temporary decision will help sustain licensed child care subsidy providers and help ensure families we serve have access to high-quality child care. Importantly, a child care program is eligible to bill for absent days as long as they remain open or if they reopen. As child care providers cannot bill for days that the provider closed their program and can only bill absent days up to the authorized hours the child typically attends their program. Providers will have to sign and submit an addendum to their existing subsidy agreement, and this form is available on the DHH website and in our child care frequently asked questions posted on that website. Instructions regarding submission of this addendum can be found there. This executive order will provide financial support for child care subsidy providers, allowing their businesses to stay open and provide care for children for working families. These decisions will help ensure families can continue to access high-quality childcare across the state, providing new opportunities for employment for some Nebraskans who may have lost their job due to COVID-19, and support local communities by ensuring we maintain the childcare network across our state. Thank you.
Great. Thank you very much, Stephanie. And thank you very much with your help and your team's help on that executive order. Appreciate it.